All right. Okay, welcome all. Thank you for joining us. I hope parking wasn't too bad, but I know it probably was. Just to kind of introduce the program for tonight, you all know roughly why we're here. We're going to talk about the healing of the soul from the perspective both of Orthodox tradition and secular contemporary psychology. But just to give a sort of like a brief idea about why this topic is worth addressing, like what do the two things have to do with each other? I wanted to read you a quick passage that sort of inspired this panel. So this is from St. Athanasius's Life of Anthony. It's a description of the way in which people from all over Egypt back in the 4th century used to come and come to see St. Anthony. He said it was as if there were a physician given to Egypt by God. For who went to him grieving and did not return rejoicing? Who went in lamentation over his dead and did not immediately put aside his sorrow? Who visited while angered and was not changed to affection? What poor person met him in exhaustion, who did not, after hearing and seeing him, despise wealth and console himself in his poverty? What monk coming to him in discouragement did not become all the stronger? And what young man coming to the mountain and looking at Anthony did not at once renounce pleasure and love moderation? Who came to him tempted by a demon and did not gain relief? And who came to him distressed in his thoughts and did not find his mind calmed? So there's this sense in which, from the very beginning of the monastic movement, which is the beginning of the ascetic tradition that we have in Orthodoxy, there's this sense in which ascetics are almost physicians of the soul, right? Anthony healed people physically too, but in this passage, all these people are coming to him in mental distress. And there's something about Anthony, something about his ascetic lifestyle and his connection to God that's able to alleviate the distress. So that's a theme that's in Orthodox spirituality from that point on, and before that too as well, that a big part of what we're trying to do as Christians, whether we're monastic or lay people, is we're trying to arrive at a kind of health of soul. We're trying to heal our passions, try to cultivate virtues and so on. And so that's been a part of Orthodox tradition for ages. But the topic of tonight is how that ascetic tradition engages with contemporary psychology. Because now with the rise of modern science, we have a completely secular, evidence-based, science-based sort of science of soul therapy. In fact, psychotherapy just means soul therapy, so from Greek word for soul. So what you have before you are three, and not four, I'll explain why, three Orthodox Christians who are also psychotherapists in various ways and areas. And so I'll get them to introduce themselves for a moment. Before I do though, we were going to have a fourth, Margaret Tadros, who is our lecturer in counseling, but unfortunately her husband and daughter have both come down with, it sounded like a rare disease called COVID. It sounded quite serious. I feel like we should tell someone about it. It sounded like it was very contagious. So she couldn't make it. But we still have three lovely Orthodox psychotherapists with us today. So why don't we'll start with you, Anastasia. You just introduce yourselves briefly.
Wonderful. I'm Dr. Anastasia Veronis. I'm a clinical psychologist, work in clinical practice and also a lecturer at University of Technology, Sydney.
Father George Liangas. I am a parish priest at St. Nectarios Greek Orthodox Church in Burwood. I'm also a child psychiatrist, so I guess Dr. George as well. I'm in private practice 2 days a week as a child psychiatrist.
So I'm Ramsey Andrews. I'm also in private practice, mainly working with adults. And so I specialize in things like trauma, adults obviously with depression and anxiety and things like that. So mainly in private practice.
Okay. Sorry about that. I missed all your introductions, so I have no idea who you are. But I trust you're all who you said you were. Okay, so what we're going to do is we have a series of questions, way too many questions to actually get through. But for about 45 minutes, we're going to just work through some of these questions that will give us a sort of foundation. Are you all able to hear us just out of interest? Yeah. Until the mic works, we might just have to just project your voice a bit. So we'll work through some of these questions that will sort of give us a foundation. And then with the time that's left, we'll aim to be done by sort of 8:30, 8:45 at the latest. We will open up to questions. And so I'll explain again when we get to the questions, but I think for the sake of the recording, it might be best, unless you're really, really shy, if you could just sort of come up and ask your question, or sort of stand, come to the middle, ask your question so that the mic here can pick you up. Yes, okay, so in that case, let's jump into it. So the first thing that I wanted to ask you all is, before we start to talk about any particular issues, let's just get clear about the idea of mental health and illness itself, because that kind of assumes an analogy between the mind and the body, right? So just as a body can be sick or healthy, you can have a sick or a healthy mind. Do you think that's a useful way to think about the mind? Is it in some ways like the body?
The first thing I'd like to say is to make a distinction based on what you said before, which just to alleviate confusion, that when we talk about, say, psychology, psychiatry, psychotherapy, the Greek word psyche means the soul, but the way it's used in modern secular practice, it's not the soul. It is the mind. So, and the Greek word for mind is nous. So you should be a neurologist or a noicist. I don't know. It gets a bit complex. So yes, we're talking about slightly different things. That the secular practice is sort of mental illness, and I like to make the distinction so we don't confuse, or secular sort of practice doesn't really think about the soul as such. It sort of deals with the mind. So that's the first thing. The other thing I'd like to say is that the Orthodox conception of the mind is the sort of the body-mind is a oneness. We don't have this sort of the duality to sort of say that the mind is separate from the body. Well, it's helpful in some ways. I'm a psychiatrist. I don't use a stethoscope anywhere near as much as a GP or a physician in most other specialties. So I've sort of, but it's helpful to conceptualize it in some ways, but also recognize that there is that sort of, we don't have a duality as such, but one can affect the other.
Okay, fair.
So I was just going to touch on something as well. You were talking about sort of mental health and mental illness, and I guess within psychology we do conceptualize these things as being slightly different, in the sense that a mental illness is a diagnosable psychiatric disorder, but mental health sort of speaks more broadly to that, and that someone can have a diagnosed mental illness but still be mentally healthy, in the sense that they are flourishing. And during COVID, a lot of these sort of terminologies came sort of to the forefront around flourishing and languishing. So during COVID, people were not necessarily feeling mentally well and healthy, but did not necessarily have a mental diagnosable illness, and that sort of fell in that category of languishing. So just to sort of clarify that difference as well.
Okay, that's important. Did you have any thoughts on that, Ramsey?
I agree with that, but I guess one aspect of your question was, like, is the mind similar to the body, in the sense that it's a very real illness that actually occurs, as opposed to, people who think that, you just don't have enough willpower, or, whatever it is, but just because you can't see the mind, it doesn't mean that it's not actually diseased, or there's something that's beyond your control that actually occurs. And we were talking about a therapy called EMDR therapy. This is a very clear example of how this works. It's a new therapy that's basically come up over recent years for people who have been traumatized. So the way this therapy looks at different mental health conditions, whether it be anxiety or post-traumatic stress symptoms or whatever it is that the memories are actually stored in a part of the brain where it's not supposed to be stored, if proper processing occurs. And with this proper therapy, what actually happens is the memories shift from one part of the brain to another. And as a natural byproduct of that, what happens is the flashbacks go away, all of these mental health, post-traumatic stress disorder symptoms disappear, So that's probably a good example of how the mind is, just because you can't see it, it doesn't mean that these things aren't actually really happening to the person. The person's not just making these things up.
That's kind of what I was getting at with the question, in that your body, in the same way that the body it can sort of look fine on the outside, but it's so complicated that there can be things really wrong that aren't even immediately obvious to the person who's suffering from them. That's sort of what I was getting at. Is there a sense in which the mind is this sort of complex thing with parts, which different parts of them can malfunction or function in ways that are unhelpful. And so that it's not just a matter of willpower. There's an actual sort of structural issue that needs to be dealt with.
If someone's depressed, it's so easy to say to someone, I'll just get over it, or
right, because it's just your feelings, right? It's not a physical problem. It's
One thing that we find in mental health is this thing called the biopsychosocial model, where if you have major depression, you conceptualize things from many different aspects. You've got the biological aspect of it, that to some extent it is somewhat genetic. There is a genetic component to it, and then the psychology of the person and the social circumstances, and then you could tag along with it the sort of the spiritual elements as well. You're going to come back to that as well. So that is we're in a privileged area, complex in many ways, because we need to be sort of thinking about all these things and how they act on the person when someone presents with mental illness.
I think a lot of psychology, there is coming up this whole idea of the biopsychosocial spiritual model now. So I think modern science is starting to recognize that there might be something, spiritual there, but there's not enough empirical research. There's not enough that's been done, in modern science to actually make it a thing, in modern psychology. So. Okay,
this leads to another sort of important foundational question. It's probably a hard one to spring on you, but in a sort of clinical setting, how do you define mental health? Because mental illness assumes that there's a sort of, you can tell the difference between proper functioning and malfunctioning. So what is the state of mental health? How do you know that someone is,
I think a large component of it really comes back to the impact that a particular, anxiety or depression may be having on an individual and the functioning of their life, because we may all go through periods where we experience different emotions to different degrees and intensities. But when we think about kind of mental illness, we really need to be looking at the functional impact that has on a person's life and how significant that is.
Okay.
I could have a particular diagnosable phobia, but if it's a phobia that's never impacting my life, there's a question of, do I actually need to go and get treatment and therapy for it?
Generally speaking, there's things that it's a hard question to answer, because, sort of, how do we feel? How are circumstances in our lives? Are we content? So sort of various sort of domains of it that relates to, mood and how happy we are generally in our lives, how content we are with the circumstance of our lives, whether we're able to function at a level where sort of we would be expected to function, and so forth.
Okay, so I'm hearing, functional, the function is a big part of the definition there. Sorry.
I've actually got the definition given by the World Health Organization. It says it's the state of well-being in which the individual realizes his or her own capabilities to deal with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community.
Wow, that's also a functional definition. That's really interesting.
And I heard a contemplation on that definition. So someone was saying, I can't remember what it was, but I heard it being said that it's basically, what was it? I've written it in somewhere. It's the ability to work in love, summarized. It's the ability to work in love. And then a few other contemplations that, again, I'm not aware of the exact ins and outs of it, but I think it was actually Father Thomas Hopko, who said that sanity or mental health equals sanctity. And then that's a whole nother discussion in itself.
Okay.
How Christ's, Jesus is a model of, sanctity and sanity. So that's, I guess, one angle or one way of.
Okay, yeah, we're coming to that. Like we'll come to the sort of spiritual aspect. Okay, so I mean, yeah, that makes sense. That's a sort of measurable, empirically detectable measure of of mental health versus mental malfunctioning. Okay, yeah, I'm thinking we should move to the spirituality stuff, but before we do that, I wanted to. I always ask psychologists this, but what are some things that you wish that people knew about mental health and illness? Are there common misconceptions that you come across that you would like to correct for 70 people? Small step. No?
I often speak to people sort of in a broader context than just mental health, but the way in which mental health relates to so many other facets of life and communities, in the sense of relating to addiction, relating to homelessness, relating to domestic violence, relating to disability. And I think I'm always a big advocate for working sort of across sectors and across these different domains, and always coming back to, people don't choose this for themselves. And so for us to be very compassionate and understanding of a person's struggles and the hardships that they're experiencing. I do a lot of work with people who have addictions, and there's a lot of sort of stigma and shame for those individuals. A lot of people in their lives who will just say to them, we'll just stop drinking or stop gambling or whatever it is they may be doing. But understanding that people are born with vulnerabilities to particular mental health disorders and addictions as well too. So to always just hold that compassion.
Okay, yeah, very interesting. It goes back to what Ramsey was saying at the beginning about sort of the assumption that because it's in the mind, it's a matter of purely free will. Yeah.
And that sort of, basically use the word stigma, shame, and you must not talk about it in the family or whatever. And that's something that, yes, we just need to sort of break down. We all have our vulnerabilities. We're sort of broken humanity, and sort of some of these disorders is just part of that.
Okay, that's actually a really good lead into the set of questions on spirituality and mental health, because the stigma that you're referring to probably comes from, like Ramsey was saying, from sort of this assumption that let me not say too much, let me leave it for you to define. Let me just ask you then, I'm sure it's already come up a little bit, but you're aware of the tendency that we sometimes have to spiritualize mental health problems. So, the classic example is someone going to someone and saying they're really depressed and being told to just, pray more about it, trust in God more, and that should do the trick. And so it's generally acknowledged, I think, that's a very risky strategy, can often have, to put it mildly. But I suppose the question that I want to ask first is why? Why and how do you sort of navigate the line between a spiritual issue versus a mental health issue?
Can I? One of the things I think it's helpful to conceptualize is to go back to first principles and to talk about how religion and science should interact. This goes back to my theological studies. And there's there are four ways in history that those two fields have interacted. The first one is the hostile position. That the two are sort of loggerheads, that one of them feels that the other sort of group is wrong, and there is that sort of hostility. And it's sort of, people like Copernicus and Galileo, and the way that they were treated by the church because they were sort of challenging the assumptions that had become an entrenched part of the faith, or the carriers of the faith, and so forth. So suffice to say that we don't feel that that's an appropriate way to be. The other way is to sort of, have those two side by side and to sort of not have much interaction between the two. The religious people look at things one way, the science people, and having very little sort of room for interaction. And whilst that's a better position, I don't think that's a helpful position either. The opposite side is to sort of try and syncretize and sort of have a system that explains it, a religious scientific system that sort of explains everything. And I don't think that's a helpful position either, because your science and religion are two different bodies, fields. They look at things in different ways. They ask different questions. And to sort of try and synthesize the two is going to do injustice to both. So I think the most sort of productive and appropriate way for those two to interact is that sort of the dialogue, and which is what we're doing today. To sort of this is one body, and this body is looking at things in a particular way. This body of sort of study is looking at things in a different way. There's a particular dialogue. There's a sharing of ideas, of concepts, and one learns from the other. So mental health is a very valid body of work, as we've said. Our faith is also a very sort of accepted, a very trusted, sort of some of the things that you read from Life of St. Anthony, and to sort of keep in our mind that there are two sort of separate disciplines, but they can talk to each other, and there's a lot that one can learn from the other.
Okay, so they maintain their independence, but are sort of equal conversation partners.
Yeah. And that helps me to sort of be able to sort of manage those two aspects of my life.
Okay, no, that's very helpful. So to apply that to the issue, is there how do you actually navigate, in a case, for example, of depression? Is there something dangerous about the temptation to explain it as a purely spiritual problem? Because you can see whether, to give it the benefit of the doubt, the thought is something like, well, if this person was really in close connection with God, they would be filled with hope and faith and love and etc. So they wouldn't feel that the world is so dark. And how do you, is that a dangerous temptation? Should we resist that temptation to explain what a psychologist would call a mental health problem as a spiritual problem? Or
I think, as probably Angus is saying, like there's room for both. So if someone is going to, for example, a doctor or someone, and the advice is to pray, that's a really valid thing in and of itself, as would it also be to go and see a mental health clinician and get advice and guidance and support that way. And the two can most certainly work together. It doesn't have to be an either or, and perhaps if we try to put it in the box of an either or, we run some risk there, as opposed to what's going to work best for that person in that context.
Okay.
Yeah, I think the whole idea of so how we look at the human person and the composition of the human person, and we're composed of a body, a spirit, a soul, and a psyche or a mind, and the danger in elevating one aspect of the human being. It's all part of the one person, and they all work together naturally anyway. And I think the danger of elevating one more than the other is that you risk putting two parts of the human being in opposition with one another. So if you, believe that the spiritual component of a human being is more important or greater than the physical, or the psyche or the mind, then you're going to believe that if you fix things at the level of the spiritual, then that's going to fix, and it might definitely have an influence on the physical. And we see this in the lives of saints, not always, but there's a tendency for saints to be very physically healthy but not always, because they sometimes get ailments, and that can be for the glory of God. But I would say the best thing that makes sense to me, the way to look at it, is that they're all on an equal playing field. Okay, so you've got the spirit, the body, and the body is not more important than the spirit. The spirit's not more important than the body and the mind, and they're all equal. And they're all we approach each one of those in a very Christ-centered way. So when you're having confession, when you're partaking in the life of the sacraments of the church, and so on and so forth, that's all obviously very Christ-centered. But if you then go and see a therapist, or go and attend to fixing your mind, by going and seeking counseling, whatever it is, that should also be very Christ-centered. And it's Christ who is the healer. And if you, like I said, elevate one aspect of the human being on top of another aspect, then you're not sort of recognizing the actual reality of the composition of the human being. That sort of makes sense.
The trouble of saying something like, if you're depressed, you just need to pray more. That is an extremely flippant comment. And it actually does injustice to both the science and the faith. Firstly, because it is a comment that's embedded in a lot of prejudice. In the Greek Orthodox Church last Sunday, we had the miracle of the man born blind. And there was a prejudice there because they saw the man born blind and they said, did he sin or did his parents sin that he was born blind? So there was an assumption that he sinned, which Jesus sort of threw it on his head. So to say, you just need to pray more is sort of saying that you lack faith. And therefore, that's why you're depressed. Now, okay, sure, if we were holy, we probably wouldn't be depressed, but I know of saints that had, particular sort of mental illnesses as well. And we're called to have compassion. And we're called to, to sort of support one another. And sometimes we try and do that, and sometimes we fall short. The example of Job, and he was in great tribulation. His friends tried to comfort him, and they said some silly things. You must have sinned. All these sort of prejudices. So we've got to be very careful when we're sort of consoling. The church fathers like St. Anthony, he had this great spiritual insight, which was born out of decades of asceticism. We'll come to, I guess, sort of later on, where they were able to diagnose from a spiritual point of view and a biopsychosocial view, even though they weren't trained in medicine and the like, but because of their, the sort of inspiration and their virtue, they sort of became sort of, leaders in that field as well. So for us to sort of say that it's lack of faith, you need to pray more or whatever. Sometimes we'll say it because we don't know what else to say, but we just got to be very careful not to sort of use our faith to cover up our flippancy, so to speak.
Okay, yeah, that's a very good answer. So yeah. Okay, so leading on from that, what would you say then to an Orthodox Christian who suffers from a kind of mental illness? How should we conceptualize that as Orthodox? Like, where does that fit in within our theological worldview? Is it, so we've sort of discussed a flippant and unhealthy way of, just to sort of dismiss it as a result of sin or lack of faith. Where does it fit into a sort of proper holistic Orthodox worldview?
It's an illness with biological, psychological, social, and spiritual aspects.
So sort of like you would think of a physical illness, basically.
Yeah, but it's sort of the physical complexities because mental illnesses have sort of all those extra dimensions that we spoke about. Physical illnesses do as well, we know that stress, does all sorts of things to the body. It gives you headaches, it increases your blood pressure, you get stomach ulcers and the rest of it. So there is that the mind and body sort of connection in physical illnesses as well. And you have the whole body of sort of psychosomatic medicine and things. But yes, an acknowledgement that, you sort of, like Anastasia said, sort of got to manage the medical aspect of it and you've got to manage the spiritual aspect of it.
Did either of you want to add anything to that? How an Orthodox Christian should think of?
I think it should definitely be recognised that, we can't say that it's not as a result of sin at all, because most certainly that can be a factor that contributes. There are definitely some cases where I think it's not as a result of sin at all, but sin does play a part. And so the advice would always be a very balanced approach, and it would be, go and, using that person's spiritual resources and their community and their confessor father and all of that kind of stuff, and encourage them to address that aspect and the spiritual aspect. That's really, really important to rule out any of the, spiritual ailments that might be there because of sin and whatnot. But then, if it's clear that they've actually engaged in, a spiritual canon and practices, and they've actually, the mental health symptoms are still there or there, for months on end or years on end, well, then that's obviously a sign that they need to address this issue from a psychological perspective that cannot be resolved, through the, I guess they are part of the one person, but we've also got to, as Father George Angus was saying before, is that there is it is helpful to see them as somewhat distinct, at the same time.
There's a saint in our church, in the Greek Orthodox Church. His name is Saint Panelists Basias. His name day is coming up. He, if you have a look at his life, he probably had a bipolar disorder. So he was a very holy man. He did miracles, but at certain times he was fine, and he would sort of serve as a priest or whatever. But at other times, there's sort of periods where he just wouldn't function. He'd be sort of in his, I'd assume he'd sort of in a depressive episode, and at times he would sort of be in a manic episode as well, and doing all sorts of things. Now we've got this concept in the Orthodox Church, the fool for Christ, and some of them were really just sort of putting it on as to cover their humility, but some of them probably had mental illnesses, and some of them probably a combination of both. And you sort of feel okay that they were holy. So, but they had an illness which we could say is probably like what St. Paul says, the thorn in the flesh. There's something that humbles them even more. And you might say that if Saint Panelists Basias had access to modern medicine, he would be sort of fixed there. But in many cases, he's a saint now, so he doesn't need to worry.
Yeah. Okay, that's very helpful.
I was going to add one more thing, which is in psychology, we talk about this concept of dialectics, which simply put means two things that seem to be opposite can both be true at the same time, and we can hold space for both at the same time. So if I give a really simple example, I can be in a room full of people, but I can feel completely alone. And I think this framework is useful for us to sort of conceptualize this discussion, where we can hold space for the spiritual component, and we can hold space for the medical components, and we potentially run risk if we focus too heavily or in too much of a closed way on one or the other. But for us really to be able to hold space for both, I think as Father Angus and Ramsey have said, that balance is really important.
There is a tendency to be very black and white, I think, especially in our Coptic Orthodox community. I don't know about other communities, but there's definitely this cultural thing. I think that it's probably not an Orthodox thing, but it's a cultural thing that says, okay, well, yeah, it must be stemming from some kind of sin, or it's either, I think, this putting the spiritual and the other aspects in opposition, or sometimes confusing the spiritual for the psyche, because they're both unseen aspects of the human being. And so there is this tendency to kind of confuse them. And so if somebody's depressed, or somebody, has a mental illness, well then, they can't be a saint, or they can't be, something along those lines. There's a really interesting story, actually. So who's aware of St. John of Kronstadt, in the Eastern Orthodox tradition? So so apparently he used to visit these mental asylums, and because he used to be able to connect really well, and he'd be able to talk to these people who were experiencing some mental health issues, lots of different issues that we know what their diagnosis would be today, but back then, they would be seen as like just really loopy. And there's this one lady in the mental asylum who Father John sort of, who he connects with, and she, yells blasphemies, and she, yells things out, and that would have been seen as, okay, well, she's obviously got a spiritual disease, but it's what we now know today is, Tourette's syndrome. So he would go and administer her the holy mysteries, and he'd be questioned, why are you giving her holy mysteries? She's quite clearly, she's, Father John, she's blaspheming and all this sort of stuff. And he says something really interesting. He says, but it doesn't touch her soul.
Wow.
Okay. And that's really, really profound. So it is possible that you know, somebody, there's all these other factors, not necessarily, you know, a spiritual problem. You know, the same way that you were born with a physical ailment or a problem, you know, there are mental health issues that can also.
That's a very profound. Yeah. Okay.
Could I just, firstly, lightheartedly, in response to Ramsey's comment about some of the cultural biases and things, one of the greatest challenges I have is to tell the second generation Greek Australians, people like myself, that their kids need medication for their ADHD. It's they just, you know, come up with all these things. It's a nightmare. But anyway, that's beside the point. We talked about how medicine looks at the sort of biopsychosocial and model and things, but let's also look at how the church fathers would have looked at mental illness in those days. And there's a beautiful book by Lachey, Jean Lachey, I think, is a French writer, I think in the Russian tradition, who talks about the three major domains. Firstly, to say that the church fathers had an amazing understanding of medicine in their time and an amazing respect for medicine. If we look historically at how mental illness has been viewed, prior to Hippocrates, it was all related to the spirits. So the spirits did this and the spirits did that and whatnot. And it was Hippocrates that first raised that these illnesses are organic. So when we come to the time of Galen, he is systematizing the sort of mental illnesses that have some organic basis. So he talks about mania. He talks about melancholy, which is Greek for black bile. He talks about phrenitis, inflammation of the surrounding tissues around the brain that causes probably an encephalitis in today's terms and so forth. So there's a very sort of, very impressive system of mental illness or mental manifestations of physical illness. And the church fathers were aware of these sciences. Of course, we know that people like St. Basil the Great and Gregory the theologian, they had studied all these things and then had accepted them. And they incorporated them in their teaching, in their life, and the rest of it. So there was the illnesses of organic origin. There was the illnesses of demonic origin, which requires a certain amount of spiritual insight that as a psychiatrist and even as a priest, I don't feel I possess. It's not something that you learn from books. It's something that is a gift of the Holy Spirit, you could say. It's something that the very holy people are able to have that discernment through their holy life. So for example, and I don't want to say too much about it, therefore, but suffice to say that the devil finds our weaknesses and is able to wedge himself into our weaknesses, give opportunities, for us to have more or less sort of a demonic influence or even demonic possession. So there's that aspect of it. And the third aspect is the mental illness that does have a spiritual origin. So Evagrius talks about that. Various other church fathers talk about, which is a very fascinating field.
Okay, yeah. Okay, yeah. Okay, that's very helpful. I mean, I feel like I'm realizing now the answer to most of my questions is it's complicated and it depends on a lot of I make the point flippantly, but it's actually also, I'm also realizing that there's a lot of danger, especially here, in sort of being too overly theoretical and trying to find sort of universal definitions, because individual people, actual people are very complicated. And so there's always a very sort of messy intermixture of physical and spiritual and social and cultural factors. And so it's okay. For the sake of time, we can stick on any point for hours, but let me move us on to some questions about so this is that third section I warned you guys about on ascetic tradition. So this is basically, I wanted to just pull out a few ideas from that I'm familiar with from ascetic literature and just sort of interrogate you about how they strike you as practitioners of 21st century psychology. So the first one is, let me put it this way. So when I read someone like Evagrius or any of the Desert Fathers and their advice on dealing with the passions, I'm thinking particularly with Evagrius here, actually, there's a strong emphasis, goes back to what Ramsey was saying before, on free will, right? So that at any point when you're struggling with sin, really it comes down to you, right? Which has there's a practical reason for speaking that way, because but so it seems to me as well, from the little I know of like contemporary psychology, we have a lot more insight now into the sorts of factors beyond our control that kind of predispose us to certain behaviors or make us particularly, something of things like schemotherapy and that sort of thing, where there are causal factors that have nothing to do with your choices, with your free will, that affect the way that your mind is and might make you sort of disposed to act in certain ways. So is that something that to put it provocatively, is that something the Desert Fathers got wrong? Did they not realize that we're born with wounds and these problems that are out of our control? Well,
I'm thinking, can you repeat what Evangelist said?
Sorry?
Can you repeat what Evangelist said?
Oh, it was just a summary, but just I was saying I get the impression from him, because he speaks so much about free will, that there is no, that he doesn't seem to have room for the idea of an inbuilt fallenness in the soul. The more that I say that, the more I realize it's not entirely, like, there are other aspects of, because he talks about the passions too. But I'm just asking
Look, it's interesting you've mentioned Evagrius. In the very last sort of topic that I did at St Andrew's Theological College, it was science and religion, and my topic here was Evagrius of Pontus and other church fathers, writings on sadness and how may enhance contemporary medical understandings of depressive disorders. It's about how you use that knowledge. So, for example, Evagrius talks about sadness, lipi, Greek, which is not synonymous exactly with depression, but for the purposes of today, it's a very similar concepts. He, for example, talks about lipi being related to a frustrated anger, Greek word thymos, and frustrated desire, Greek word epithymia. So they're both etymologically very closely related. Thymos is another word for the heart. We use the word thymos in modern psychology, psychiatry for mood. Say someone's euthymic or hypothymic or something like that. So thymos, anger, epithymia, desire, right? So Evagrius is saying that a frustrated anger, so an anger that you can't express, that you sort of internalize, that'll become depression. Now, I read that, I find that a very useful concept when I see patients. I won't talk to them about Evagrius or anything like that, but sort of, desire, and in modern days, desire, all pleasures come from desire. And the fact is, we're sort of conditioned to live in a world that's so comfortable, and we want a materialistic world and so forth. So when we're not able to sort of have what we desire, that leads to depression. That's an interesting concept, especially in today's age, which is so materialistic and individualistic and so forth. So they're very useful concepts, but how are you going to use those concepts? That requires that discernment from a spiritual point of view. There's a modern day saint in the Greek Orthodox Church, Saint Porphyrios. Now, he was illiterate. He went to about 3rd grade, but because of his holiness, he attained so much wisdom. Plus, he loved to read, and he didn't just read spiritual things. He read medical things. He read scientific things, and so forth. So he was a bit poo-pooing of the psychiatrists. So it goes a bit against what we were saying before. But I think what he had a problem with is sort of secular psychology being dismissive of faith and the spiritual dimension. And he was able to, much more than I, to have this sort of spiritual acumen, which also incorporates the biopsychosocial model. So in one of his talks, he says the following, and sort of this is a talk which is recorded. You can actually hear him speak and so forth. He gives this example of this woman who had a very severe depression, and she was okay, and then she was chastised by her husband, which immediately flipped her into a depression. And then she was talking about how she went to the doctors and all these medications and so forth. And he goes, did anything happen to cheer you up? And then he talked about how a sort of a friend from her youth came and they met after many years, and she became happy and they went out for coffee. It's sort of, if you go back to the sort of frustration of desires, and, sort of sort of being in this sort of a repressed sort of marital, relationship and so forth. So he was able to diagnose that her depression was in relation to her circumstances. She used to be a pianist. And I know Dr. Hronis is a pianist as well, it's just coincidentally. And he started to make her well by getting her, she was sort of in bed all day and so forth, to start playing the piano again. So that's quite an astounding thing, and start to, sort of gave her a bit of insight as to sort of, how her, her sort of her frustrated anger and so forth might have been affecting her and so forth. But he took on a very sort of biopsychosocial and spiritual view in being able to help this lady. And of course, talking and basically, but the center of what he was saying is that Christ is the middle of everything, and having Christ and desiring Christ was part of her healing, because in Christ we find everything. Now, does that negate all the psychological things? No, because there's a lot of things that you need to work with. Sometimes you do need medication, and maybe that's my bias, I don't know, and so forth, but you do need all these other things to help you get well.
That was wonderful. Thank you. I'm thinking about free will again in the context of coming at it from a balanced perspective, and not to speak solely from an Orthodox perspective here, but a way in which psychology and spirituality have been well integrated, I would say, is, if anyone is familiar with something called the 12-step program. So again, I speak from addictions, that's sort of my area of specific knowledge within mental health. But if you've ever seen like AA, Alcoholics Anonymous, any of those, they're actually spiritually based programs. And at the end of every meeting that they may have, they say the serenity prayer. So it's, God, grant me the serenity to accept the things I cannot change. So I'm going to hand over what's not in my control. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, my free will, and the wisdom to know the difference. And I always come back to that key last part, the wisdom to know the difference, in that, yes, I do have free will in some components, and there are things I can change, but there are also things that are out of my control and do need to hand over. That's very interesting. It sort of reminds me, I'm not sure if it's in Evagrius, but in Pseudo-Macarius, which I'm sure you've also come across, he has a distinction between, he's very clear to distinguish between the business of uprooting the passions, like removing your passions completely, which is only God's prerogative, versus fighting the passions, which is your prerogative. You have to distinguish very clearly between what is only for God to do, and he does in his own time, in his wisdom, versus what's in your power to do. So yeah, it's really interesting that in something like a 12-step program, which is ostensibly a secular, it's not religious explicitly, but there is still that distinction between sort of what's in your control and what has to be left to, a greater power. Sorry, Ramsey, do you have anything to say on that, on free will?
Just going to mention another approach that's part of what they call the third wave of psychological therapies that probably come about in the last 20 or just over 20 years or so. It's called like ACT therapy, it stands for acceptance and commitment therapy. And it's one of the more popular mindfulness-based therapies. And so rather than the more traditional psychological approaches like CBT, where you're challenging thoughts and sort of getting rid of them and doing all of that kind of stuff, it's a totally different worldview. And the mindfulness here is very different to other forms of meditation that have more kind of like spiritual, Buddhist roots and things like that. So this type of mindfulness that's used in this particular therapy is very scientific, and it's very, very, it's very different to the kind of meditation that you would do that's more spiritual, like Eastern Buddhism and things like that. So in this particular approach, there's this part of the self that they call the observing self. So again, it doesn't call it the spirit or anything like that, but it's the observing self. So when you diffuse, is the word that they use, from your thoughts, and you enter into this space within yourself, you can, from that position, you can observe physiological things, you can observe your mind, you can observe And what the therapy encourages you to do is to just let those thoughts flow, you know, and pass by. And you're just an observer of those thoughts, so that you're not taking responsibility for those thoughts, which then helps you to take responsibility for, which is the most important part of the therapy itself, which is your values, and to start acting based on your values. And the mindfulness is only important insofar as it serves your values through committed action. That's why it's called acceptance and commitment therapy, the commitment towards your values-based goals. So maybe it sort of relates to what you're talking about there, in the sense that, you know, you can't, you know, if what's going on up there is kind of rooted in the passions, or that by using the observing self concept, you're not taking responsibility for that. And you're focusing on what, you know, and I find that it's a great therapy that's really compatible with our Orthodox faith, Christianity. So,
okay, yeah. So it's basically, so I mean, to orthodoxify that, that's basically saying you're not your passions, right? You sort of, yeah. Okay, really interesting. Okay, well, so in order to leave time for questions, we've probably got time for one more of my annoying questions. I'll try and choose the most annoying, which I suspect. Okay, no. Let's end with a sort of practical question. So to sort of tie things up and maybe give us some insight that we can sort of take practically. So as you would all know, as sort of practicing psychotherapists, the therapist-patient relationship is a really, really important part of what you do. It's not like a GP where you don't really have to like your GP that much. They don't have to like you. It's nice, but I mean, you know, they give you the medicine, and you know, it's a very. It's
for sure about that.
Yeah, okay, I can see where they go wrong. I love my GP, by the way. Yeah, I don't. But all I mean is that the relationship aspect is less important, in that, you know, you can deal with, you know, if I've got a flu, you can prescribe me the medication and so on. Whereas here, the relationship is part of the therapy, right? Part of the actual healing process is, it's not just that you're imparting knowledge. There's an actual there's a therapeutic relationship, which is part of the healing process. So as people who sort of practice that for a living, do you have any advice for how, in general, sort of non-psychotherapists, lay people, what are some things that we can all do to be more present for people around us? What are some insights that you gain from dealing with people in that therapeutic relationship? What is it that really helps people, in other ways, what I'm asking?
The research says the therapeutic relationship between a client and clinician is the biggest predictor of therapy outcomes, above the type of therapy that we're doing, above how much the clinician believes in that type of therapy. That the relationship is the biggest predictor of the outcome. So it's incredibly important. And I think the factors that enhance that relationship are things like feeling heard, feeling validated, feeling like you have a safe space to be able to speak openly with someone, where you're not going to be judged in a negative way. So if we translate that to how we can help our friends and family, I think there's very similar qualities there of being non-judgmental, of being validating, of being compassionate, and supportive in the best ways that we can.
I mean, the short answer is love your neighbor, but unfortunately, sometimes we just get too caught up in ourselves. Sure, some people are just instinctually sort of better able to sort of connect and just be and empathize and that sort of thing. But we can all strengthen our empathy muscles. And I think the key ingredient to that is our own repentance. Because when we are in repentance, then we realize our own failings, and therefore we're in a position to really reach out.
Yeah, I think in answer to this question, it's probably an area of psychology that we call coaching, coaching psychology, which is not an area, I mean, it's an area that I'm familiar with, but it's, I guess there's a lot of principles in coaching psychology that help you, for instance, not just to kind of cosmetically listen to somebody, you know, but actually listen and be aware of your own like psychological phenomenons that actually occur, such as, you know, projection, you know, and the more you're aware of that sort of thing as well, the more you won't fall into the traps of saying certain things or doing certain things that might risk a person feeling invalidated. I mean, it's hard enough for somebody to to be honest with themselves about their own faults and their own things, let alone to talk to another person.
Mm-hmm.
So coaching psychology would have a lot. I mean, that's a big topic in and of itself. And, you know, there's lots of stuff that, like things like projection, where you might have, you know, certain things that you don't like about yourself, for instance, and what you do is you sort of project that onto other people, or, you know, transference, and there's all these different sort of things that go on, and the more we're aware of that, the more we'll sort of tend to maybe sit back a little bit. And I guess one piece of advice is, don't feel that you have to, and I think in fact, because if you jump to trying to solve the problem without you realizing, you're actually not giving the person what they need. You know, what they need is just to be heard, and just to kind of, again, you know, what really needs to occur for that healing process is just that safe space. And there's there are many people who don't have any serious mental health issues who go and open up and speak to such a person. It could be their confession father, it could be a counselor, it could be a psychologist, and that's all they need. And somehow those problems just sort of the next day and the next few days, they just kind of resolve. See that happen all the time. So don't feel that there's a rush, or that if you feel there's a pressure on yourself to solve a problem, because that's how we're geared to think a lot of the time. You know, there's a problem, I've got to offer a solution. And you've got to get out of that framework, if you like, and get more into a mode of, you know, allowing yourself to be a values-based person and see yourself as, okay, I'm engaging with this value of listening to the other person, just genuinely listening and not thinking about what I'm going to say in response to what they're saying. And when you engage with those values more, you're really helping that person heal, you know, spiritually, physically, mentally. So
that's fantastic. As all three of you were speaking, it struck me how well represented the sorts of characteristics you're talking about are in the ascetic tradition. Because there's, I mean, you know, like for example, there's a whole section in the classic edition of the Desert Fathers just called non-judgment, all the sayings of the Desert Fathers about non-judgment, because we often think of them as quite sort of rigorous and, you know, because of their extreme asceticism, but they're actually really strongly committed to the idea that they don't know anything about anyone else's sins. They only know about themselves. And so anyone who comes to them, there's a very sort of passive listening quality about them, which is sort of what we saw with St. Anthony at the beginning. Okay, that's fantastic. Thank you all so much for that part. So I think we should open up for questions now. So if you've joined us since, I think if it's possible, if we could sort of like line up so that you can be here when you ask your question, that would be best. Although if you really don't want to, just yell. So open to you all for questions. I see a hand. Yeah. You might have to yell very loudly.
A few questions actually. So I'll start with one and then. Ramsey, you mentioned sin as potentially playing a role in mental health. I was just curious, do you believe that Christians are more vulnerable in experiencing particular mental health issues, like for example OCD, depression, due to guilt and shame associated with sin? So you have like perfectionism, which plays a role in anxiety. In which alternatively, people who are not Christian would not experience, since the idea of viewing the behavior as sinful does not exist for them.
yeah, absolutely. I think depending on what sort of Christianity you subscribe to, that's going to make all the difference when it comes to this sort of issue. If you subscribe to a kind of Christianity where, I remember, growing up in Sunday school and always being told by elder people around myself, growing up as a child, there was this sort of really heavy focus on not upsetting God, in Arabic, say, so there was always this kind of emphasis.
Just right then. Let's keep it
Yeah. So, and I think that's not sending a very Orthodox Christian message about, how we understand, how we should understand as Orthodox Christians, the nature of humanity and some misrepresentation of who Christ is, and it's a really big misunderstanding, I think, and unfortunately, I think this issue is still prevalent for a lot of people, and if that's what you believe, then definitely it could lead to a lot of shame. I was dealing with a client who he had couple of traumatic experiences, and that led him to start, drinking a lot of alcohol to experientially avoid what he was internally experiencing. And then because of the shame, so this person was to church every week, and so on and so forth. And because of the shame that they were experiencing because of the alcohol, drinking alcohol and being addicted to alcohol for a number of years, he basically stopped going to church because of the shame that he felt. And I remember him kind of saying that he was watching this really funny story. He was watching a documentary on TV one day, and he saw some indigenous, village somewhere. I can't remember where it was, and they were administering crucifixion under medical supervision to people who believed that if they were to experience the suffering of our Lord, that they would somehow be healed of, all of their, problems, and whether that be physical, mental. And so he got that idea and he had it in his head, that was the only way that God was going to accept him. So you've got these really strange ideas, and a lot of ideas, related to guilt and shame, unfortunately. But so in answer to your question, to keep it nice and simple, yes, I think we are, depending on the Christian community you're a part of, you can definitely be more at risk of developing OCD. I mean, there's a lot of other factors as well. There's genetic factors and a lot of other things as well.
My reflections are, I think the research actually shows that if you belong to a religious community, that's protective. And there's various ways you can conceptualize that if you're at least a religious person, you belong in a community more, in the biopsychosocial model, that is a protective social, factor. We should also say that, yes, people that present with blasphemous obsessions, sort of intrusive thoughts about, sort of that something about God, something blasphemous about God, or Panagia or something like that, that those people are more likely to be religious than not, because it's, God is more in their lives. But OCD, and I'm not using this as an example, OCD is just an illness such that it's going to grasp onto something or other. If it's not religious, it'll be something else. So if you're not religious, then your intrusive thoughts might be about something else. In saying that, there's a distinction to be made between being religious and being faithful. So the religion is the outward expression of someone's faith, and they're not synonymous. And sometimes in that sort of rigid religious environment, you are predisposed to things such as guilt and shame. But that's not coming from an ideal place spiritually. And we recognize that in our churches, there's people that are on different sort of paths of the spiritual journeys, and we just need to accept that. And religious people are just as much risk of developing some mental illness as non-religious people. Probably there's a protective factor, but that doesn't mean that they're immune from mental illness, and they might be predisposed to other things like you suggested.
you have anything to add to that? Working on, yeah, cool. Did you have another?
I'll ask another one. That's a different one. Probably a bit more. As people in the mental health space, how do you reconcile like stories in scripture where a prophet or a character, hears the voice of God, or give them Elijah, still small voice, or Moses, burning bush? Do you find yourself psychoanalyzing that at all? And if not, how do you differentiate something like schizophrenia or something like that? I'm just curious. What do you say to that?
Look, sorry, I don't want to stop talking too much. No, I find that distinction very clear in my mind. That an illness like schizophrenia is not going to be just hearing voices on its own. You'll have perceptual abnormalities. You have persecutory ideation. You're going to have your cognitive deficits. You're going to have your negative symptoms of schizophrenia and so forth. That if someone hears the voice of God, as it says in Scripture, I take it at face value, and I know that can still happen at our time. What's the rest of their lives like? If the rest of their lives is holy and they have what we call the charisma, the gifts of the Holy Spirit, sometimes it's we just accept it. If Saint Porphyrios can sort of tell the future, and then it happens, then that's a gift from God. If it doesn't happen, then to question. So the way that they're portrayed in the scriptures, and we know that sort of God reveals himself in the Old Testament, in the New Testament, is to me looks like totally different to mental illness. Sometimes there is a blurring. I mentioned before about Saint Paisios Basias and the Fools for Christ. So they sort of characters sort of blur the lines a little bit. But yes, no, I don't read the story of Elijah and think there's some mental illness. No.
Cool. Next question.
Just listening throughout I'm Josh. Hello, nice to meet you guys. Which was really good, really insightful. Just listening throughout the questions, a word that comes back to mind has been balance. And so when I think of balance, I think of like kind of tipping on the scale. And the more I kind of read up on mental health and such, another word that comes to mind is integration. And so like metaphor could be the three spokes of a chair. You speak of bio, psychosocial, mind, body, soul. So I guess my question is, what practical suggestions can you make to cultivate and order the interior life towards a balance or integrated way? Because it's very easy to think, oh, I'm underweight, overweight, let's go for a jog, or let's eat well, or my mind is not in an orderly state, so let's see someone. But in terms of the spiritual life, how do I integrate that with both my body and my mind? Does that make sense?
I would bring it back to what we've been speaking about as to the complexities of many of these issues, and that it's often not as simple as making one change in one domain of my life and sort of experiencing good mental health. It really comes back to integrating and looking at, as Ramsey was saying before, a values-driven life. How can I act in line with my values in a holistic way where I'm addressing all the different areas of my life, not just sort of focusing on one particular one of those and thinking that will change things.
One thing I'd like to talk about is prayer. Secular psychology have integrated the concepts of mindfulness, which, as you may know, come from Eastern transcendental meditation practices. And I seriously believe that the way it's practiced by psychologists is it's not a threat, like sometimes I get asked, most of the time they're good strategies to have for some of the things that Ramsey spoke about. The fundamental difference between a meditative practice, as is in secular psychology, and a prayer is that in prayer we put Christ in the center, and in other meditation practices we don't, which is why it's sort of mindfulness came from the Eastern practices where that was sort of more acceptable than from us, even though we're just, I would say, is just as mystical and spiritual, if not more, because it puts Christ in the center. It relies on the faith in Christ. So having an active prayer life, I think, gives us a lot, and it's proper prayer. I'm not sort of, I mean, it's nice to sort of, say your morning prayers and your evening prayers. I say cultivating the Jesus prayer. That there's a lot of mindfulness. There's an amazing amount of mindfulness in that. There is an amazing amount of acceptance and commitment with Christ at the center, which makes our mindfulness and acceptance and commitment all the more, I don't know, richer. That's been putting on my, being integrative, and, in my practice, if people don't have a faith, I won't talk about that, but if people do, then I will. So I'm respectful of the other person, sort of where they're coming from. I'm certainly not going to impose prayer on someone who, I usually won't initiate such a conversation. It's only if someone sort of initiates it first. But I think that, there's other things as well. But one answer I could give is having a living prayer life is so helpful in sort of cultivating a healthy mind, for lack of a better term.
Yeah, I think there's lots of direct spiritual exercises that you can do. I mean, maybe just attending a liturgy and learning more about the hymns of the church and the tunes themselves. The theology and the tunes, aim to lift the spirit, and in the liturgy, the priest says, lift up your hearts, lift it up to in other words, your spirits, your spirit gets lifted up. So that's a direct, but we shouldn't, separate them too much, the spiritual aspect and the psyche and the body, because when you are doing a bodily act, like such as exercise or something along those lines, that even that exercise should be Christ-centered as well. So there is some influence on the spirit,
Could I qualify something, because I know it's being recorded, and I don't want this to come out. When I talk about there's nothing wrong with sort of mindfulness, I think we need to be a bit careful here. There's a lot of things that the mindfulness practices are very good. If you sort of, a simple mindfulness practice is to sort of sit quietly and to observe the textures, the colors, the things. It's something that is a grounding exercise, and I would say there's nothing wrong with that spiritually. But my kids in even preschool and kindergarten were doing essentially yoga exercises, and I actually took my kids out of that, because it's not just these mindfulness, it's actually prayer postures of Eastern religions. And actually did at the time an extreme thing to pull my preschool child out of their yoga exercises. So I do want to sort of just qualify to say that, yes, we need to be careful with some of these things, but I'll leave it at that.
Yeah. Cool.
That's me.
Yeah. Good stuff. Yeah.
Sorry, I didn't mean to send. Hi, my name's James. Thank you so much for the talk, first of all. This question comes from my own personal experience, but I suspect there are a lot of people like me. So, having grown up in the church, I felt quite, I guess maybe, if I'd heard this talk when I was younger, I would have said, this is silly, all I need is prayer and all that type of stuff. And so growing in that mindset and then facing various problems that, I faced in my life journey, I faced two oppositions, which was the spiritual, church priest or confession father saying, you just have to pray, this is, about your relationship with God. And then the other side where, Western medicine says, or completely dismisses the spiritual aspect of I guess, whatever I was going through. So what would you say to someone like myself back then, or someone now that might still be in that mind frame to, I guess, get them on a bit more of a healthier track? Because I think, people can have connections with, their mental health clinicians, or can also have a connection with a church father that they're very close with. And so if each of those sides is very conservative in their approach, how can you, I guess, help someone break out of that mindset or find a healthier approach to whatever they're going through, if that makes sense?
I would say don't dismiss either, and make space and make room for both, because there definitely is space and value and a role for both the mental health clinician and the confession father, and having the faith, as well as having a clinician who is separate to that and can also provide support in a different way. I think we run a lot of risk when we fall into this kind of all or nothing, either or space. And I don't think that the outcomes for people at the end of the day are good when we sort of tip the scale too much in either direction. So we come back to like balance being the key word, and looking at how we can hold space for both of those in our life.
Certainly younger people, and you sort of mentioned that sort of that age does make a difference to sort of pick up the nuance of these things, and younger people are going to be scandalized, perhaps more than older, I don't know, that may not be able to pick up some of this nuance, and a lot of damage does get done. I guess sort of trying to sort of support an integrative approach, and some spiritual fathers are sort of perhaps more conservative, and there's certainly a role in for that. And a place for that in perhaps a different cultural context or whatever, I don't know. But there are other spiritual fathers who, just through their nature or through their background or whatever, are a lot more integrative. So, just like with a psychologist, sometimes it's about getting the right fit. And, you might not sort of glue with one psychologist. My recommendation is, let's have a look at another one, because that might, it's about creating that fit. And it's like that with the spiritual father as well.
So just to clarify what you're saying, are you saying that because growing up, I know it was not a great thing to sort of hop from one confession father to another. So are you saying that just like you might try to find the right, clinician that you gel with, that would also be okay with a spiritual father?
Well, thanks for bringing that up, Jess, because you don't want to sort of get that impression that you can sort of jump from spiritual father like that. Of course, there are some people that have a long sort of relationship with the spiritual father, and it's not the role of anyone to sort of try and sort of get in the way there. But I suspect that if sort of they received that advice and they were affected by it, then that relationship with the spiritual father is a lot more tenuous. So if for someone looking for a spiritual father, then yes, and they sort of trying to get the right fit. Then we advise that if you've got that right fit, you sort of stick with it. You don't just sort of change because you just don't like their advice. But there might be occasions where you've got a long relationship with a spiritual father and you're struggling with that. But that needs to be worked through, the relationship with your spiritual father. And it might be the outcome that you change spiritual fathers, but that's something that's done with the blessing of your spiritual father. But yes, if someone is looking for a spiritual father, there is scope, at least in my understanding, and the other fathers can correct me, that you can sort of look to see who's the best for you. But if someone's got a long-acting relationship, then that's different.
In our Coptic Orthodox liturgy, we pray, say, fill our hearts with joy and gladness, so that having sufficiency in all things, we may grow in every good deed. I was curious, is having joy and gladness mentally a prerequisite for us to grow in every good deed spiritually?
Mm.
Generally, a relationship with Christ gives us a lot of joy. And the other thing that it gives us is a lot of peace, you know, sort of, and the liturgy is very big on peace. In peace, let us pray to the Lord for the peace of the whole world. And so let peace be with you. Interestingly, there's no equivalent in psychology for peace, not a direct equivalent anyway. But so generally, yes, but there's always exceptions and always qualifications to that. For example, there are great saints that have experienced the absence of God, and that's been very difficult for them, but that was part of their growth, spiritual growth. God has sort of taken away his grace, and it was through their absence of God they were able to grow more. Other people, like I said before, their depression is the thorn of the flesh. That you just need to sort of, you grow through that. I was reading a book, Lincoln's Melancholy, a while ago. Abraham Lincoln had according to this book, had a very severe depressive illness. And the writer of that book, I don't remember who it was making the point that it was through this adversity of such a severe depressive illness that he was able to achieve what he could, because, you know, his mood was just so low so much all the time that, you know, abolishing slavery, he didn't care about the repercussions because he couldn't feel any worse than he was. So yes, the liturgy and our relationship with God ought to give us a lot of joy, but in some cases that may not be the case, but we still sort of, you know, through patience possess your souls.
That's interesting. Father, would you, or not any of you, would you distinguish between joy and sort of like mood and happiness? So, I mean, perhaps we do get the joy that we're talking about, but that doesn't necessarily mean we're always sort of, you know, chipper and...
Yeah, I don't think it's necessarily referring to like a euphoric feeling because emotions are always linked to the body, you know, and there's always physiological responses in the body to certain emotions. I think I was using this example. I mentioned this to you the other day, Sam. One of the scales that I'm sure, you know, both of you use all the time is the depression, anxiety, and stress scale. And it's a questionnaire that measures those three scales of anxiety, depression, and stress. And it's done from time to time to track people's mood. And there's a question there. It says, you know, a statement. You've got to rate how you felt over the past, how true this statement was for you over the past week or so. And it's, I felt that life was meaningless. And there's plenty of people where they rate that as a 0. Okay, that I felt that life was completely meaningless. Like, in other words, I didn't experience a lack of, I didn't feel that life was meaningless. Yet, pre and post measures would show a significant reduction in depression, anxiety, and stress. But the answer to that question remains the same. So there's something that's getting them to feel that their life is meaningful. There's some, there's a relationship there. You know, there's a relationship with Christ, and I think that relationship brings us joy and gladness. And I would like to think that joy and gladness is similar to that vitality and that meaning that I feel in life, no matter how low my mood gets. And we know that there's a lot of there's biblical examples, like Saint Paul, you know, was despairing to the point of death, for instance.
Prophet Elijah, when he was running away from Ahab.
Yeah, and they really had a relationship with God, you know, at those times. So,
so you can be clinically depressed but still joyful. It's kind of,
absolutely.
Yeah. All right, cool. There's probably time for one more question. Oh, well, we can, it sounds like there's two. We can, yeah, we can manage the two. Yeah, yeah, please.
My question is more about the kids. So basically breaking the cycle, whether like the parents or basically in conservative community, sometimes have like these misconceptions about the relationship with God. And now like God, the mighty God is watching us and we are upsetting him with the bad things. And we inherited the same kind of concepts, especially with us as roles as servants or as parents. How can we help out with giving some kind of practical guidance to make sure that we correct these kind of concepts?
So how should we teach our kids to view God in ways that are,
whether I'm a parent or a servant?
You're going to use concepts that the children can grasp. And when the child is young, you will say God gets angry. Now, well, does God get angry? Sort of does God get upset? God is perfect. God is passionless. He doesn't have emotions in the usual sense. But what else are you going to tell the child about sort of your relationship with God? Needing to improve that relationship with God, or sort of sometimes you're relying on these anthropomorphisms in a stage of a child's development. St. Paul talks about, when, a child needs milk, but then as you grow up, then they have other sustenance. My oldest daughter now is 12, she's in year 7. I'm encountering lots of sort of early adolescent stuff and angst and moodiness and all sorts of things. But this is a great opportunity to actually, build on those concepts. On the way here, I was taking her to chanting classes, which she didn't want, so it was a bit of a drag for her. And she was talking about this teacher does this, his teacher's this, and sort of backing out as you would. And that was an opportunity for me to talk about, life, sort of St. Paul saying, the strong ought to help the scruples of the weak. And in life, you get people that you like and people you dislike, and you sort of, as long as you maintain that sort of healthy relationship with your child, then as the child grows, then sort of you're able to sort of impart more sort of sophisticated concepts of God and things. You can't say, well, God is love. What is love? Love's an abstract concept. Before the age of 12, children don't have, sort of abstract reasoning. They've got the concrete sort of cognitions, operant think. Sorry, these people know these terms a lot better. So they're not able to, so to sort of say God is love is an abstract concept a child won't get. So you would just say God is loving. That's a very small change, but I think you get the point. That's sort of with a younger child, you'll have to get more concrete. But as the child sort of goes into adolescence and can sort of pick up these abstract things, you can talk about more abstract things.
Should we move on to the next question? Did either of you want to add anything to that? So sorry, was it Rania or Sam?
All right, yeah. Thanks for a really interesting time. I guess a couple of things really struck that we said. So one thing that you said, Ramsey, was about this idea about, you didn't use the term, but being with, which is a term.
Sorry?
Being with. You didn't use that term specifically, but being with someone who's experiencing this, some of the friends and experience that's happening, sharing their experience, listening, and sharing the emotion with them. There's something Father George said about the importance of prayer and having this connection. And I suppose the thought that crossed my mind as well is, aren't we meant to suffer? We went to suffer, aren't we meant to get depressed? I guess putting all those three concepts together, aren't we meant to use depression or anxiety in terms of forming a close relationship with God and deepening our experience of prayer?
So they're both looking this way. Look, if we get scriptural, can we compare the despair that Elijah felt with the depression that Saul felt?
Very different.
Very different.
Yes. Yeah.
That Elijah experienced the absence of God like many of the church fathers. And that was a very uncomfortable feeling. God allowed that. And he allowed that, I guess, because, he's just achieved such an amazing thing, that sort of Mount Carmel and the fire and the bull and the rest of it, that can lead to pride. So Elijah needed something, the absence of God, to help him grow spiritually in humility. Saint Nectarios, has anyone watched The Man of God? Right, it'll be publicly in the film at cinemas this month, I've been told, or June. He suffered enormous injustice. It wasn't fun. God allowed that because he grew so virtuous through that. So that's the adversity which is part of our spiritual lives, which we need to espouse, to accept. There was a very recently canonized saint in the Greek Orthodox Church, Saint Evmenios the New. And what struck me is he got a diagnosis of leprosy. And he got joyful. And his words were, the bigger the cross, the more I can lift up Jesus's cross, the bigger the resurrection. So adversity, yes, we accept as part of our spiritual journey. Saul's depression and Esau's depression too. Esau, sort of his brother got the birthright and he just, sort of that frustrated desire that I spoke about before. And St. Paul talks about, sorry, I need to refer to my notes here. In Hebrews chapter 12, it talks about the root of bitterness in Esau, which leads to sadness, as it's elaborated on by Evagrius. And in the case of Saul, because David was more popular, he got jealous, and it was the envy that led to that frustrated desire, even though he was king. So there's a different quality here. Adversity is not synonymous with depression or lippy, as sort of the Evagrius talks about. Adversity is something we accept with joy as much as we can, as much as our own sort of limitations allow us. That's different from some of the spiritual illness that people like Evagrius talks about.
All right, wonderful.
Is there space for a joke?
Well, there's always space for a joke.
So I heard that the first hermit also had, was suffering from a mental illness. He was diagnosed with bipolar disorder. I tried.
And with that, we shall. Well, thank you so much for attending. That brings us to pretty much just over our time limit. And thank you to our panelists so much. Could we just give them a quick. We'll conclude with a quick prayer. I saw the food was delivered, so it's upstairs. So if you just walk upstairs, you'll see a area the food should be sort of laid out. So feel free to hang around for a bit. And yes, thank you all once again. So sorry, Father, would you mind praying for us once again?
You guys pray Christos Anesti?
We do.
Yeah, all right. We can all pray in our own way. It's the last day before the leave taking of the resurrection. Christos Anesti ek nekron thanaton patisas ketis en tis mnemasi zoin charis amenos. Christ is risen from the dead, by death trampling down on death and bestowing